Hi, today we're going to talk about the augmentation mastopexy, which is a breast lift combined with the placement of an implant. It's a breast implant augmentation, and the procedure is a bit complex. There's some details that I would like to convey and also clarify. In terms of the breast augmentation component of the case, or the placement of the implant, you will find that that's the first procedure that I do, the first step in this combined or combination procedure. The augmentation is done by placing the implant under the muscle, and then subsequent to that is where I set the highlights, I set the shape of the mound, I make sure there's a nice fullness in the upper pole of the breast, enhancement of the cleavage. Subsequent to that is when after sitting the patient up and laying them down, we determine where the new position is for the breast. To raise the breast is also reshaping the breast. And the shape goes from a flatter, more hanging presentation to a more up and tighter, more contoured, just a more beautiful breast because it's more balanced with the shape of the body. The breast is a more youthful appearing presentation, or has a more youthful appearing presentation when it's lifted, as opposed to just the augmentation alone. And one will see in this video, as I show the steps, what it looks like without doing the lift, and understanding then what the lift offers and the details of the lift. This is a combination of procedures that's done commonly. The augmentation mastopexy is not an unusual operation. However, the results vary, and also it's a quite complex operation. And it's a surgery that takes about 3 to 4 hours, and there's a lot of details involved. And I'll try to convey some of these details as we proceed with the surgery, and that'll be coming up next in the intraoperative segments that you'll be seeing, to where I'm maxed and gowned and covered up, but I will try to explain to you the steps, and it's essentially 3 steps. The first step is the placement of the implant, setting the fullness, setting the cleavage, setting the mound, and think of the breast as a mound, and then bringing the breast tissue that's redundant or hanging down back up to a more youthful, more perky position. And that's the lift part of the case. And then the third step is the setting of the nipple in position to make sure that they're not too high, and also making sure they're evenly placed. And we'll proceed with such. Thank you very much. Dr. Sergio Maggi here at the Austin Plastic Surgery Center. I'll be seeing you in the operating room next. Thanks a lot.